A fever in a 2-month-old baby requires an immediate ER visit, but the same fever in a 6-month-old might just need monitoring at home. The age of your baby completely changes how serious a fever is, and I'm about to show you exactly when to worry and when to wait. Fever is the #1 reason parents call me after hours. Today, you'll learn how to take an accurate temperature, understand what fever means at different ages, and know exactly when your baby needs immediate medical care. First, let's talk about taking temperature correctly, because the method matters. For babies under 3 months, rectal temperature is the most accurate. A rectal temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher is considered a fever. For older babies, you can use temporal artery, forehead, or tympanic, ear thermometers, but they are less accurate in young infants. Avoid pacifier thermometers and forehead strips. They're unreliable. Armpit temperatures run about 1 degree lower than core temperature, so add 1 degree to that reading. The age of your baby determines how urgently you need to act. Birth to 3 months, any fever of 100.4 degrees Fahrenheit or higher requires immediate emergency care. Young babies can become seriously ill very quickly, and a fever might be the only early sign. 3 to 6 months, a fever needs a same-day pediatrician evaluation, but not necessarily the ER unless other concerning symptoms are present. Regardless of age, call 911 or go to the ER immediately if your baby has a fever plus any of these symptoms. Difficulty breathing, working hard to breathe, or blue lips/face. Extreme fussiness or won't stop crying despite comfort measures. Unusual sleepiness, difficulty waking up or seems out of it. Signs of dehydration. No tears when crying, dry mouth, fewer wet diapers. Neck stiffness or sensitivity to light. A rash that doesn't fade when you press on it. Seizure or convulsions.
Never give aspirin to children. Use lukewarm baths or washcloths, not cold water or alcohol rubs. Remember, a fever itself isn't dangerous. It's your body's way of fighting infection. Focus on how your baby looks and acts, not just the number on the thermometer.
Call your pediatrician during office hours if a fever lasts more than 24 hours in babies under 2 years, a fever lasts more than 3 days in older children. Your baby isn't drinking fluids or seems dehydrated. You're concerned about how they look or act. Fever can be scary, but knowledge gives you confidence. Save this video for future reference and share it with other parents. What fever questions do you have? Drop them below. I answer every comment. Subscribe for more pediatric emergency tips.